Yalimadat. I'm Dr. Salim Sarani, one of the lung and ICU specialists. I serve as a professor at Texas A&M University, Texas, in USA. I'm here to discuss you about the coronavirus or COVID-19. As you may have been very well aware and you've been educated, tremendous work has been done in that area and tremendous knowledge has been shared with a lot of our folks around the world. We know that we have talked about some of the uh, measures which we can prevent, just like physical distancing, wearing a cloth face protective covering, washing our hand, disinfected the surface. But let's talk about today something which is more interesting and coming up. So one of the thing is that when it is safe, what is the second wave? What are the therapies which we have? So we're going to discuss some of those factors. So if you look at it, that when is the second wave coming? We talk initially about when the viruses were coming in, we see a rapid surge in the virus, and we talk about the physical distancing, trying to wash your hand, wear the face cloth covering, and try to flatten the curve. So when you try to flatten the curve, the main purpose was that we don't want to see a tremendous amount of infection coming in very quickly and affecting a lot of population, so our healthcare system cannot take care of it. So we try to flatten the curve, but it doesn't mean that the virus has gone away. So what we need to do is continue practicing the same. And also the thing which we know that can protect us from spreading of the virus is what we call is a herd immunity. And what is the herd immunity? Herd immunity is something where if you patient or a lot of the population have the antibody against the virus. And how does it happen? So it can happen if you get an infection with the COVID-19 and your body recovers and develop the antibody, which can fight with the infection if it has to come in again. On the other hand, it can also happen if you get a vaccination, which helps us to develop the antibody. And it says that if 70% of the population will have the antibody against the virus, then when the virus tries to come in, it tries to prevent the spread of the infection. And that is one of the very, very key factors in prevention of the infection. So we all know that not 70% of the population is infected. And also we know that the vaccination is not there yet. We have been working on vaccination very diligently. Almost 130 kind of institution across the country or across the globe are working and developing the vaccination, whether it is based on the messenger RNA basis, it's based on your previous VCG vaccine status, or the adenovirus-based messenger RNA vaccine. So that is in development. But what about the therapies? What we saw initially that there was some therapies coming in which they talk about the hydroxychloroquine. So the initial small study or report shows that it shows some benefit, but then larger study shows that it doesn't show much benefit, and there were some studies coming in which shows it have a side effects. So initially the FDA kind of approved the emergency use of this, allowed the emergency use of the hydroxychloroquine, which is a medicine which you use for malaria, but now they have actually withdrawn it because the data and evidence is coming in. It's not showing that it is helpful that much, and moreover, every drug has its side effects. So what are the couple of the therapies which we have in the availability which is showing some progress? You may have heard one of the medicine called remdesivir, which is a medicine which folks were using to treat the Ebola virus. There were a couple of trials, especially one of the bigger trial, which was done by the NIH in USA, and it shows some promising results. So people who are taking the remdesivir has a lower chance of dying compared to the people who has a COVID-19 and are not taking it. So the FDA has issued an emergency approval, or not kind of approval, but emergency usage allowability, while we are getting more data till the final approval can come in with the due process. The second thing is what folks are using, and the preliminary results are showing some good successes, but that is also a challenge because we don't have any control arm. So we have given it to a lot of the patient convalescent plasma, and they have shown some improvement. So what is convalescent plasma is? What happens is any time a person gets infected and the person develops the antibody and recovers from the COVID-19, their blood or plasma actually forms antibody, and that antibody has the capacity to kind of fight with the infection if you have to have it again. So what they do is, just like when we do the blood donation, you go to the blood bank and they separate your the red blood cell and plasma is something which has a lot of antibody, and that plasma is given to the person who is now infected with the COVID-19. So there has been a lot of studies going on, and preliminary results are showing that it does have some value. There is another study which has come out in the Lancet journal where they use an antiviral medication like ritonavir and lipitonavir as in combination with ribavirin and beta interferon, and that has also shown some promising role in trying to slow down the infection. So in other words, we have some therapies coming in, but one of the misconceptions with a lot of the folks have it is that, oh, well, we have a therapy, it means we have a cure. Answer is, we don't have a cure for this disease yet. The question is, well, we are going to get a vaccine. Normally, vaccine development takes 3 to 5 years, but they have been working at a rapid pace. And there is a hope that, we may have some vaccine by the fall or later part of this year for some emergency use, and maybe by the first quarter we can have vaccine development at a substantial number. But again, if you look at it globally, to vaccinate a lot of population, and 70% of the population, is not easy. Some folks say that, well, let's go out and get exposed to the virus since, the young people tolerate it good, and we will develop the immunity. Sweden did that, but they also, by doing that, they had an increase in the number of the death compared to the neighboring countries, but they also did not achieve 70% of the population having antibody. In other words, only 5% of them develop antibody, which is not adequate to create a herd immunity. So in all, my message is, again, as you have heard, we talk about the therapies, we talk about the vaccine, we talk about second wave. It's not the question whether if you are going to get the second wave, it's the question is when. And if you can delay it as much as you can, hopefully by that time we can have a better medicine, better cure, and better vaccination. Try to be safe and have a good day. Thank you, and Yali Madad.